Let me ask you a question. Can a patient have a perfectly normal blood pressure and still be in shock? The answer is yes. In fact, if you're waiting for the blood pressure to drop before recognizing shock, you may already be behind. Today, I want to change the way you think about shock. Let's forget about medicine just for a minute. Imagine your local Amazon distribution center. Every morning, trucks leave the warehouse loaded with packages. Those trucks travel all over town delivering what people need. Now, imagine those trucks suddenly stop making deliveries. At first, nothing seems wrong. The shelves still have supplies, people are still going about their day, but before long, neighborhoods begin running out of what they need. The problem isn't the warehouse. The problem isn't even the trucks. The problem is the deliveries aren't reaching the destination. That's the easiest way to understand shock. Now, let's apply that to the human body. Your heart is the warehouse, your blood is the delivery truck, and the oxygen carried by the red blood cells are what? The package. And every cell in your body is waiting for that delivery. Your heart doesn't exist to make blood pressure. Its real job is to deliver oxygen to the body's cells. Shock begins when those deliveries start failing. So, why do so many people focus on blood pressure? Because blood pressure is easy to measure. But blood pressure isn't even one clue. Your body is incredibly smart. When oxygen delivery starts to fall, it compensates. It increases your heart rate. It tightens blood vessels. It directs blood to the brain and heart. For a while, blood pressure may still look normal, but the body is already struggling. Let's look at the patient. 21-year-old motorcycle crash victim. Heart rate is 138. Blood pressure is 118/74. Cool skin. Pale. Sweaty. Delayed capillary refill. Would you call this patient stable because the blood pressure is normal? Absolutely not. Everything else is telling you oxygen isn't getting where it needs to go. Now, let's change the situation. Instead of trauma, let's say it's sepsis. The patient still has a normal blood pressure, but they're confused. Their heart rate is elevated. Their skin is warm. Their body is still struggling to deliver oxygen effectively. Different cause, same problem. Is it shock? If you remember one thing from today's video, let it be this. Shock is not defined by low blood pressure. Shock is a state where the body's tissues aren't receiving enough oxygen to meet their needs. Blood pressure helps tell the story, but it's never the entire story. As an EMS provider, we don't treat numbers. We treat patients. And the earlier we recognize shock, the greater our opportunity is to make a difference. I'm Ryan with Fire Ready Leadership. If this explanation helped you see shock in a different way, subscribe and join me for the next lesson. In the next video, we'll answer another important question. Why can blood pressure look normal even when a patient is getting worse? Until then, stay safe, keep learning, and always be fire ready.